Hi, we are talking about sinus arrhythmia. So what is a sinus arrhythmia? It's an irregular rhythm that arises from the sinus node. It's usually paradoxical, meaning that it increases and decreases with inspiration and expiration because of stimulation of the vagus nerve during inspiration. Sinus arrhythmia is common in children and young adults, and it's rarely a problem. So even if the heart rate increases a little with inspiration and decreases slightly with expiration, even though the beat is irregular instead of being a regular steady beat, it doesn't usually cause any negative hemodynamic effects and is not usually noticed by the person that has this. The characteristics of sinus arrhythmia is the rate is still going to be between 50 to 100 beats per minute because it does arise from the sinus node. So any rhythm in arising from the sinus node is between 50 to 100 beats. It will still have normal P waves in front of each QRS complex. It's usually a normal QRS, so there's not a wide or irregularly shaped QRS. It will be normal. The PR interval will be also normal, and the P to QRS ratio is still 1:1. So for every P wave, you have a QRS complex. The only characteristic really with the sinus arrhythmia is that the beats will not be exactly evenly spaced apart. So it's just a slight arrhythmia. It's very common, or it can be very common in children and adults, and usually subsides by early adulthood. You see it less often with older people. Occasionally, there can be heart defects, such as a valvular defect, that causes this rhythm. And it can also be seen during stimulation of the vagus nerve, such as when suctioning, defecating or straining, and also with vomiting, that it can cause this type of arrhythmia. These changes with the SA node, it's just the rate changes slightly with inspiration and expiration and does not usually cause any negative effects. However, so treatment is not necessary. However, if there is severe bradycardia or any type of symptoms related to this, then you would treat the symptoms and then ultimately treat the rhythm.